Hey guys, I'm Patel. I'm a gastroenterologist. I was in Chicago for the last 5 years, and I just moved to Orange County, California last week. So I'm very excited. Yes, Lima, West Coast represent. And I'm really pumped to be, starting soon to see both pelvic floor, functional bowel, and esophageal motility patients. And I have a subspecialty in that. So I'm really excited to get on with these amazing ladies and speak about that.
Awesome, and welcome to Cali.
Thank you.
By the way, Sarina and Kumkum, we've never actually met. This is just through this platform, so we've never met in person, so this is really exciting. I am Sarina Thobani. My last name does rhyme with the yogurt Thobani. Everyone's heard of Thobani yogurt. It's literally spelled the same way, except for you knock out the C and put a T. And really, that yogurt has changed the way I tell people how to spell my last name, because I would be like, T-H-O-B, and every time I get to the B, everyone would be like, B? I'd be like, no, B like boy. So now I'm like, Thobani, just knock off the C and put a T.
I love it.
I am a practicing allergist, immunologist out in Southern California. I see both pediatric patients and adult patients, so I get a whole variety, and I treat all things related to allergy and immune system. My personal passion is asthma and food allergies. I also gave a talk earlier this morning on just diastasis recti, because I'm also a mother to 4 children out here.
Woo!
That's amazing.
And Sarina?
Yeah, so my name is Dr. Sarina Pasricha. On Instagram, I'm Doc Sarina, and I am a private practice adult gastroenterologist. Like Kumkum, I also specialize in motility disorders with an interest in anorectal disease, so really people with constipation or leakage, fecal incontinence. And then I also have an interest in gut health and gut microbiome. And I am a mom to 2 girls, 4 and 6. So they are supposed to be going to bed because I'm on the East Coast. I live in Delaware. And so they might come in later, so we'll see.
Love it.
Let's get this gut party started. We're lucky that we get these 2 fabulous GI doctors here. So I'm going to start, and this question is actually going to be to both of you, but I'll start with Sarina. Sarina, what is the most common complaint that you come across in the South Asian population?
So the most common reason that people are going to see me is going to be abdominal pain. And I can say that people are going to see me as a gastroenterologist for abdominal pain, but really the most common complaint in South Asian women is abdominal pain to their primary care office, to an urgent care clinic, and even to the hospital. And so the first thing is that abdominal pain can mean something serious is going on. So if you are experiencing abdominal pain, please go see your doctor, because you need to have a medical evaluation. You need to make sure that you don't have H. pylori bacterial infection, celiac disease. You might have to have workup to make sure there's no pancreatic or liver issues going on, and getting, colonoscopy, make sure that your colon health is good, there's no colon cancer. But I really see people who have had that workup, or we've completed that workup, and then they're still experiencing pain. And what it ends up being is irritable bowel syndrome. And I would say that I see in about 10 to 20% of my population is irritable bowel syndrome. And irritable bowel syndrome is actually seen a lot more commonly in South Asian women compared to even Caucasian women or African American. So it's really a lot more prevalent in our community. And so let me just talk a little bit about that. And there is a brain-gut connection. A lot of people have heard about that. Like, to a really mild level, people might have experienced butterflies in their stomach, or if they have something big going on or they're excited, they might feel those butterflies, and that's kind of like your gut talking to you and giving a little bit of a mild irritable bowel. But when people have irritable bowel, they're experiencing that on a much stronger level. They're experiencing pain, discomfort, a change in the bowel habits. And it can be really frustrating for patients because their workup will be negative. Like, they'll have had the endoscopy, CAT scan, labs, and everything's going to come back normal. And then they think it's like a psychological issue. And so what I want to share with people is that irritable bowel syndrome is really common, and it's not a psychological issue. There are more nerves in our GI system, in our gut, than even in our spinal cord. So if we're stressed, anxious, worried, like our gut's going to pick that up first. And like that whole gut instinct is there for a reason. Like we feel something is going on and our gut is talking to us. The gut sends signals all the time from our gut to our brain and our brain to our gut. They're kind of constantly talking to each other. So it's normal to experience some of those symptoms, but if you're experiencing it and it's kind of impacting your quality of life, you definitely need to see your doctor. We have treatment options. And, you know, I think as a South Asian woman that we are really good at multitasking. Like, I feel like a lot of us are, you know, professionals, we're moms, we're like managing so many things, but we hold that stress on like in our gut. And then it manifests in discomfort or maybe diarrhea, or, you know, it comes out in ways that we don't even realize that we might be stressed out. So one of the things I talk about with my patients who have this is how important stress reduction is, whether it's, you know, doing yoga or meditating or, you know, just taking time for yourself. It's kind of important to allow the gut and the nerves to calm down and heal. So that's kind of the most common thing. I know we might talk a little bit more in detail about it, but I just want people to be aware that like it's not all in your head. Like this is a real issue, and it's really common, and you can get help if you're having symptoms.
Thanks, Sarina. I mean, that was, you know, that's helpful because I do know, you know, I have friends obviously who have IBS, and like it's so easy to be like, just relax, de-stress, but it's so hard. It's easier said than done, and really finding that time, and like you said, you know, when you have so much going on, to just really make time for yourself. But clearly, it is part of the treatment plan.
Yeah, totally. I tell people it's like, I know I can say it, but it is the hardest thing to actually do. But at least sometimes like realizing there is that connection can help people. Like, you know, because I think in some people then it's the fear that there's something else going on, and realizing there is anything else going on, your nerves are talking to you, and sometimes that's even helpful.
Absolutely. So Kumkum, I'm going to turn to you and ask you the same question. What would you say is sort of one of the common complaints that you come across in the South Asian population?
I would say 100% the abdominal pain, but usually it comes with diarrhea and constipation. Usually, you know, I'll have maybe an Indian auntie who comes in, you know, oh, you know, I saw that you see patients with abdominal pain, and I've been having constipation and diarrhea. Sometimes it's diarrhea, sometimes it's constipation. I can't figure out which one it is. I've tried changing my diet, and that by that they mean they've changed from eating 3 chapatis to 2 chapatis, or switching from eating rice to maybe, you know, brown rice. And they still have gone about their daily activities, but haven't really incorporated much more than that. And they can't figure out what exactly it is that's causing them diarrhea and constipation. And just like Sarina said, you know, when these things occur, obviously, if you're having diarrhea or you're having constipation, it can mean something more serious. Obviously, see a gastroenterologist. Make sure you don't have something like Crohn's disease, ulcerative colitis, microscopic colitis, which are things that can occur, which are autoimmune disorders. Oftentimes, microscopic colitis can occur because you're on certain medications, and basically you have a light inflammation or an anger inside the bowels itself that's causing for the poop not either, you know, be able to take its time to harden, so it's coming out and it's diarrhea. And so, you know, and a lot of people are like, oh, but I've changed my diet, but what is it? And that's when, and if you had a thorough workup, that's when it's important to realize, again, the gut-brain axis does exist, okay? There's a reason why it's called the enteric nervous system, because it is connected by the vagus nerve to the brain. And so when you have depression and anxiety, the amount of what they call neurotransmitters, your happy hormones, the serotonin, those things like that, the dopamine, those can affect how much is being produced. And if you're not having enough of it, guess what? Your bowels are going to slow down and you're going to feel constipated. Now, if you have too much of it and, your nerves just cannot calm down because you're stressed out, you've got an exam coming up, maybe you've lost a job, and with COVID and everything else going on, it's a stressful time. So don't feel that this is abnormal. This is definitely normal. A lot of things are happening and it's subconscious. Your body needs to kind of have an outlet, and the outlet is unfortunately your guts. And so a lot of people end up having the nerves overcompensate and you end up getting diarrhea. So make sure you see a gastroenterologist who's going to do stool studies, who's going to make sure that the medications you are taking is, appropriate, and then kind of figure out if that's the cause for your abdominal pain.
Yeah, great. I mean, as an allergist, I do get a lot of, referrals over for abdominal pain, constipation. Could it be a food allergy, right? And, it breaks my heart because I have to tell them, unfortunately, probably not. And I think, in order for me to explain this to everybody, we kind of have to go back and, we use the term food allergy so very loosely, right? So in society, we're like, oh, it must be a food allergy, when in fact, we're talking about an intolerance or an sensitivity, right? And so, it just basically goes back to, just the basic, pathophysiology of why, when we say food allergy. So when you come into an allergist office, when we're talking food allergy, we're talking through a very specific mechanism, okay? So instead of using the umbrella term food allergy, I like to say like adverse food reaction, okay? And under that, you're going to have different categories. So the first category we're going to say is food allergy, and that is mediated through a very specific part of your immune system called an IgE, okay? So when you're actually food allergic through the IgE, your body is producing what we call an antibody, which is called IgE, that is floating around, sitting on special allergy cells called mast cells, and waiting to attack a protein on food, right? So for example, on peanuts. So you consume peanut, and if you have a food allergy to peanut, that IgE is going to just go all over the peanut, attack it, and that allergy cell is going to start to release a lot of things, histamine being one of them, right? And that's why when you have a food allergic reaction, it's pretty immediate in its time course. You're going to end up having symptoms of histamine release, which is consistent of like hives, you get itchy all over, lips can get swollen, people can get nausea, vomiting, diarrhea, abdominal pain, okay? You can also get, just like wheezing, the respiratory tract can get involved. You might feel like that itching at the back of your throat. Sometimes if you're severely allergic, you can get low blood pressure and actually pass out, right? And the most severe reaction, which we call anaphylaxis, is when two organ systems are involved. Now, what's really important is the history. So IgE-mediated reactions are classically immediate in nature, right? So the history, when you come into my office, I'm really trying to, I'm not trying to bother you. I'm trying to dig deep. What exactly happened? What exactly were you eating? And then I want to know the time course, right? So did it happen 30 minutes, an hour, 2 hours? Most allergic reactions happen usually within minutes, 30 minutes, up to an hour. And I would say most allergists say up to a 2-hour window is acceptable for us to warrant a, food allergy workup, okay? So if I hear a history that I had some, wheat, and the next day I was having abdominal pain in my head already, I'm going down the track of this is not your typical IgE-mediated food allergy. I might be dealing with something else. So that something else is the second category, which is food sensitivity, food intolerance. And this is where, lactose intolerance, society has done a really good job labeling lactose intolerance as an intolerance, right? I have patients come to me like, oh, I have a family history of lactose intolerance. I know I don't need testing for that, because they somehow have gotten through just branding and messaging and lactate out there that that's an intolerance, and they get that bloating. But when it comes to other foods and the bloating and the constipation, we haven't done a really good job explaining to everyone out there that it's not, an IgE-mediated mechanism. And the reason this becomes important is the testing available, right? So what I offer in my office when you come in to see me is what we call a skin test, right? So it's antigens, literally antigens that we are either putting onto your arm or your back and it's testing IgE, so we're getting immediate results. You'll have panels that get placed, and within 20 minutes, I'm reading your arm, and I'm looking to see if that hide started to develop, right? So again, I'm looking to assess if that IgE is there, right? So if you come in and your reaction to gluten or whatever it may be, and you're having an intolerance, your testing might be negative. But does that mean you're not allergic? Absolutely not. You just have an intolerance. And so that's where, as far as my role, I feel like I'm like, sorry, I can't offer you the testing. My testing is no good. And patients come in and they're so disappointed, So I think it's just educating everyone out there that, the food allergy in the allergy world is usually mediated through that IgE mechanism.
That's very important because, I feel that there's a lot of, South Asian, even Caucasian patients, they have a family history written down. Oh, yes, my grandmother had it. My aunt has it. We're all allergic to egg, wheat, soy, a lot of things. And while, yes, they are a group of foods that have a lot of antigens in them that can trigger for diarrhea and things like that, you might not actually be allergic. And you're very right about that. So I'm very glad you kind of explained that pathway. So what would you say now if someone, Salima, came into your office and said, you know what, I have a lot of bloating. Forget the abdominal pain. What do you do then?
So bloating, I treat the same way as an intolerance, right? So for me, the hardest part is one, it's like a lot of explanation. And most patients actually get it. Once I sit down and I talk them through, and I'm often like drawing like everywhere so that they understand. Because they're disappointed because the first thing they walk into my office is everyone desperately wants that skin test, right? That's why their expectation is I'm going to get this panel done, right? So then I'm like the naysayer, like the person who's bringing their bad news in and saying, no, this testing is not going to help you. And I go through this process. What I do recommend though is keeping a food diary can be helpful, right? So really, if my testing is going to be negative anyway, you write, 2 weeks, right? We are like creatures of habit. In a 2-week period, you're probably going to consume pretty much more or less, whether you're eating out or eating in, things that you eat in your daily life, right? And really documenting what your symptoms are, and it's kind of painful, but to me, it's probably the most telling, right? And a couple of things come out of it. One is patients realize, oh, wait, I had, dairy on Monday and there was no issue, right? And so Wednesday, I had a little bit of issue, but then they come to realize that, yeah, there isn't a real association, because the one thing I teach my patients is that when you have a food allergy, it doesn't just come and go, right? It happens very consistently. Once you're peanut allergic, it happens every single time you eat peanut. Once you're a milk allergic or egg allergic, because remember, it goes back down to our mechanism. Your body is wanting to attack. Like the IgE wants to attack, right? So it's just, and then once they keep their food diary, we do elimination when we do trial of elimination. Now, every now and then, sometimes I do have to put a panel on to show the patient, right? But the problem I don't really like to do that very often, and that has to do with the sensitivity and the specificity of our testing, right? Our testing is very sensitive, which means when it's negative, it's reassuring. Patients are like, oh, my test is negative. But when it comes back positive, that positive predictive value is 50%, right? So you're looking at things coming back positive, but they're not clinically ever reacting. It has nothing to do with it, right? So I have patients that come into my office and they're like, I got tested elsewhere and I'm allergic to milk, soy, wheat, all like a laundry list of foods. And then I'm like, well, what were your reactions to some of these foods? Oh, nothing. So what does a test actually mean? Nothing. So we always want that history and then we do the testing, right? So when it comes to bloating, I'm sorry, my food allergy testing is not going to help.
That's really important to know. So, and I see some of the questions that are coming in, like, is it important for a person to come and see a GI for food allergies, or should they see an allergist? Well, before you kind of figure out which pathway, obviously speak to your primary care physician, and they'll help you kind of figure out which pathway, if you're having the hives after you eat something, you might want to go to the allergist first, versus if you're having diarrhea or constipation, maybe a gastroenterologist. So Sarina, what do you think? I mean, what happens when you get these bloating patients? How do you go about it?
So I see a lot of patients who their chief complaint is bloating. And when I hear bloating, like once I make sure that their medical workup has been completed, for example, it's really important that patients are getting tested for celiac disease, because celiac disease is very common in South Asians, and that can present with bloating and diarrhea. But honestly, the most important thing when I hear bloating and most common thing is my brain kind of goes to the gut microbiome and gut health. And it's usually a signal to me that there is an imbalance of the good and the bad bacteria in their gut. And so just to kind of explain that to people, we have trillions of bacteria, fungi, viruses that live in our GI tract and in our gut. And it is so important. When we eat food, we're not just feeding our bodies, we are feeding the foods that are, we're feeding the bacteria that are in our GI tract. And we all have good bacteria and bad bacteria. But when that becomes an imbalance or becomes altered, we can get a lot of GI symptoms, like we can get bloating and gas. And so I really talk to my patients a lot about diet and the role that food plays in their developing bloating and gas. And so one of the things that I often will talk with them about is kind of reducing meat and dairy, which we have seen in a lot of research studies has been inflammatory. And I try to guide people toward a whole food plant-based diet. So one that's high in fruits and vegetables, low in refined and processed foods, and low in sugar. There's been a lot of research that's been done looking at the gut microbiome, and the whole food plant-based diet has been the diet that has consistently been shown to really promote the good, healthy bacteria in our gut. And so that's a really important, I think, piece of the gut microbiome and gut health. And so when we think about food, we really have to remember that food is medicine. Like I can treat your gas and bloating in other ways, but instead of giving you a pill, I like to try and treat the underlying issue first. And so that's one thing that I kind of jump to and think about. And then when we talk about diet, I also, try to let people know that some gas and bloating is normal. Like sometimes I think people have this idea that like they're never supposed to like have like bloating, or they're never supposed to pass gas or burp, and like that's not true.
Wait, I'm not supposed to pass gas?
Like that is, normal, behavior. And so I think also understanding that is important. Now, if it's excessive, there are other things that we can do. So like, I'll give you a few examples of what I do. So there's something called FODMAPs, and people might have heard about that. It's called fermentable oligomonosaccharides and polyols. FODMAP, it's a long name. But basically, different foods have different levels of FODMAPs. And so foods that are high FODMAPs are going to be more likely to cause gas and bloating compared to low FODMAPs. Now, I don't recommend a strict elimination diet of any sort, but I do think there are things we can do to reduce the FODMAP quantity. So for example, I soak my chana, dals, lentils, and soak those in water overnight. Okay, and that's been shown to reduce some of the FODMAPs and to pull some of the FODMAPs into the water if you soak it overnight, and then you drain the water before you cook it, and that's been shown to help reduce gas and bloating. So that's like one easy thing that I do. The second thing is when you're cooking your vegetables, which we know will often cause gas and bloating, is you can add ginger and fennel, or like sauce, basically. And like I grew up eating sauce after meals and going to restaurants and eating it. And so if you put that in your cooking, then you're less likely to experience bloating and gas. So I think there's like little tips, especially for South Asians, because it's common. Oh, I'll show you another thing I have. Okay. This is like, I don't know, have you guys ever heard of this? It's called Thrifla.
Oh, no.
I just get it from the Indian store. It's a very bitter taste, but it is really helpful in reducing gas and bloating. So like that, I get it at the Indian store, and you just take like a spoon or a half spoon. I put it in my mouth, and then I drink like a full glass of water. And it's got like different things in it, but one of the main compounds is amla. So it's like a high antioxidant, high fiber. I think fiber is so key, and a lot of us are not eating enough. So these are kind of like little tips that I recommend, and like especially in South Asians, like things that we can do with our diets to help. So those are a few things.
I love that.
Yeah, I think that's awesome. Do you recommend like prebiotics, probiotics, maybe distinguish, between the two? Because I think sometimes people use them interchangeably, like the word probiotics, prebiotics, and there's a confusion.
Yeah, I mean.
Yeah, go ahead, Kumkum, yeah.
No, go ahead. I think one of the things that's really important is talking about in talking about bacteria is realizing that the bacteria is basically like the brain that controls everything. So you got to feed that bacteria with foods, right? So prebiotics are foods that are feeding the probiotics, which are the bacteria. So I know a lot of people come in and they're like, I found this supplement, and I've never heard it. They got it on Amazon, and it said the word prebiotic, probiotic, and no antibiotic. And I think the patient themselves was so confused because the word biotic was just said so many times, but they're not sure what exactly they're consuming, but they're hoping it's going to make a difference. So just to break it down, prebiotics are the foods that you eat, things like sauerkraut, kimchi, fermented foods. Now, those are the things that are feeding probiotics. Probiotics are the actual bacteria that are good for your gut in order for them to kind of proliferate and grow and make the necessary, enzymes and things to help keep a healthy immune system and a gut and how it moves. A lot of my Instagram is about how your gut is moving, right? Gut motility. And it's about maintaining gut motility is about keeping all that bacteria in a good balance, right? So if you're coming in and you're seeing me for bloating, maybe the bacteria is overgrowing, right? Maybe you've taken an antibiotic, let's say you had a cold or you had a recent infection, and you took an antibiotic and a lot of that bad bacteria got killed off, but then there's not enough of the good bacteria in your gut. And so you'll have a predominance of one and a less of another, and then those bad bacteria are fermenting and causing a lot of gas. The gas is called methane, right? And methane gas is what produces all the bloating. And so sometimes some people physically feel the distension. Other people are passing a lot of gas, and they're like, oh, I'm farting a lot. What is it like every time I eat cauliflower or every time I have Brussels sprouts? That happens as well. And again, going back to what Sarina said, those are the high FODMAP items in addition to bacterial overgrowth that can be contributing to your bloating, right? So those are all really important things to kind of consider. Sarina, I think I may have cut you off right before you were talking about your antibiotics and stuff as well.
No, go ahead. Yeah.
One of the other things I also wanted to mention was, IBS type C. There's a lot of women who come in and have had a lot of history of either depression, anxiety, especially postpartum. When you are postpartum, your hormones are kind of just out of whack, and I can vouch for that because I just had a baby about 3.5 months ago. So, your hormones are going crazy, you're stressed out, you're trying to figure out what to eat, what not to eat, what's okay for breastfeeding, how are you going to deal with the stress of having one child, 2 children, whatever, and that affects, how the gut is going to move. And if you are extremely stressed out, sometimes for some people, the nerves tend to underreact and everything slows down. And when poop tends to sit inside your gut, it ferments and also exudes more methane gas. And so you'll end up seeing a lot of the bloating symptoms there. And the more you stress out, sometimes you can go for days and feel poorly. And so that's something that needs to be evaluated. So make sure you tell your gastroenterologist, oh, hey, I am postpartum, or I have been dealing with a lot of stress in my life, or hey, I just got out of a relationship, and that's kind of around the time that my symptoms started. Like, you think maybe they could be related. I see a lot of women, they're like, well, I didn't really think they were related. I can't, I kind of put that in the back burner. I didn't want to really mention you and burden you with that tidbit, but that's very important to let us know. It's like, oh, hey, I'm postpartum, or hey, I just broke up with my husband or whatever, and this is really affecting your gut motility.
That's so great, Kumkum, because you're right. It's like what is going on in our environment is affecting our gut motility, our gut microbiome, and you can't really always separate those things. And I think it's also really important what you mentioned is that postpartum, you're going to get changes in your gut, your GI tract. And it's because there's hormonal changes. Those hormonal changes affect our GI tract. So it's not just postpartum, but maybe people even might notice like during their menses and menstrual cycles, they might get changes in their bowel frequency, or even like later in life during menopause, people might have slowing down of their gut and develop some constipation. So I think, that's a good point too, is that especially that's really important in South Asian women, is that our hormones do really make a difference. Well, I'd love to hear kind of how do you approach patients who complain about constipation?
Salima, you want to take it?
Okay, yeah. I could. So, when it comes to just abdominal pain, bloating, constipation, I lump them all into that category where I'm going to go back to my history, okay? So I always go back because, again, they obviously want testing, right? So I'm trying to elicit from you, am I getting that history of an immediate reaction, right? So I will go through my review of systems and I'll be like, any hives, any lip swelling, and if I'm not finding any of that stuff happening, then again, it goes back into my testing is not going to help you. And, and some patients will be like, please test me. And, I have to go back again and tell them, well, if it's negative, it doesn't mean you're not allergic to it, right? Your sensitivity is still going to be there. And you're falsely believing that, Dr. Thobani tested me and it was negative, but I'm reacting to wheat this way, right? So, and if my testing is positive, again, it's only suggesting there's an IgE-mediated mechanism. But if you're not having that clinical history to support that immediate reaction, then don't even worry about what my test is saying, right? So for me, I sort of, and it's always hard, right? So it's a detailed history. And sometimes I do resort to the food diary because I think it helps the patient. It's not like, for me, when I sit down and I actually talk through them and their food diary, they feel comforted by the fact that, okay, maybe she knows what she's talking about. I didn't find that correlation. I get it. Her testing is not going to help me. And I do actually go into recommending, anytime, especially with bloating and stuff, I do go back to like the FODMAP diet. And I don't know a whole lot about it, so I always pair it up with like a nutrition referral. So this was all very helpful because, as allergists, we don't get trained in that area for the insensitivities and intolerances. We're so focused on anaphylactic type reactions and how to treat those. So that's how we treat it. What about you, Kumkum?
Being in a place, in a field where I see most of the women who are coming in with constipation, a lot of them after childbirth, and they oftentimes forget to tell me like, oh yeah, I just had a baby, or I had a baby a year and a half ago and my bowels just haven't been the same. Mm-hmm. A lot of that is pelvic floor dysfunction. I know Sonia and Reina just did an incredible job of talking about pelvic floor dysfunction, but when you see your gastroenterologist, that's one of the most important things to also mention. If you've had pelvic trauma, if you've had sexual trauma, if you're in an abusive relationship, or you're in an unsafe environment where you're having things that are, a painful intercourse, or you've had a history of rape, those are very important things to mention. And again, remember, this is confidential. And so we are here as South Asian women, as your advocates here to help you. So we're here to talk about it. And pelvic floor dysfunction happens for a lot of women. And if you've been under sexual trauma, if you've had a traumatic birth, if you've had pelvic floor surgery, there are reasons that you could be having constipation other than just, I'm not eating enough fiber. Yes, that's true. You may not be eating enough fiber, but a lot of it could be pelvic floor dysfunction. And what does that mean? A lot of it is people are saying, oh, am I misaligned? No, what it means is that when poop is coming down and you have that urge to go to the bathroom, your muscles are supposed to kind of coordinate together and allow to come out and relax and allow for the poop to come out. Now, when you have something called pelvic floor dysfunction, those muscles are not necessarily coordinating together and opening. They're kind of, going like this. So it still feels kind of open, but it still feels like it's kind of closed. You're almost pushing against a closed wall. And you sit there for like 20, 30 minutes, and you're like on your phone, on Instagram, on Facebook, and now you've seen all your friends' photos and you still haven't pooped. That's a problem. And that might be because the actual muscles themselves have not completely relaxed and opened enough to let the poop out. And so that needs to be evaluated, again, to make sure, one, there's not a blockage. So you'll end up getting a colonoscopy from a gastroenterologist to make sure there isn't not a blockage. And you'll also likely get something called an anorectal manometry. This is a small probe that is inserted into the rectum or in your bottom, and you do these squeezing maneuvers, and you pretend to kind of push a bowel movement out. And using those, we can kind of check the pressures in the actual pelvic floor itself to see, are you putting enough pressure to kind of push poop out? Are you actually closing up your muscles too much? Are you actually physically or psychologically preventing that poop from coming out? And a lot of women who've undergone sexual trauma, who have previously been raped or have had some kind of trauma in their past, have maybe even psychologically retrained their pelvic floor muscles to kind of close off. And that's something they don't realize, and maybe they've buried, in their minds, okay, something happened to me 10 years ago. I'm going to just shut down. I'm not going to talk about it. But psychologically, they have kind of retrained their muscles to be like, okay, I'm going to keep everything closed, and nothing can penetrate, nothing can enter, nothing can come out. And the brain is such a powerful thing, and it's going to tell the body, okay, we're not even going to poop properly. And then you retrain your muscles to say, okay, when I bend forward or if I put my legs up, that's the only time I can poop. Otherwise, pooping is not happening for days. So if those are symptoms that kind of, are ones that sound familiar to you, please speak to your gastroenterologist, and don't be afraid to mention, in your history what's happened in your past, because pelvic floor dysfunction is something that a lot of women do experience. And again, traumatic childbirth or sexual trauma or pelvic floor trauma can be something that may be affecting you.
That's great, Kumkum. And I'm just going to say, add to that a little bit. So, because I'm sure you and I both see a lot of patients with pelvic floor issues and constipation. So some people will also have constipation and pelvic floor issues but not have had trauma. And one thing that I'm seeing is that we're seeing it more often. And I think one of the reasons might even be is because people are embarrassed to poop in public places. So they might be embarrassed to poop in their workplace or in school. And so they're actually learning at a young age, they're training their body to hold it in. And then their body kind of gets out of whack and forgets how it's supposed to poop normally, and then they develop pelvic floor issues. So that's the one thing. And then the second thing is, you mentioned that a lot of patients might have to move in a forward position or backward position. So the way people poop in India, on the Indian pots, squatting, that squatting position is actually really important for pooping.
Yes.
And so, we all, a lot of us are, in America grew up the Western way of pooping, but it's probably not the right way we should be pooping. And so I actually recommend for a lot of my patients to get something called the Squatty Potty.
Yeah.
You put your legs up and pretend like you're squatting and pooping, because that opens the pelvic floor and it allows you to poop more easily. So when you think about, maybe your parents, grandparents, great-parents, how they poop, they were doing it the right way. We just modernized it, and we've actually created problems. So
where can you get a Squatty Potty, Sarina?
Anywhere and everywhere.
I love it. And that's very true. We have a couple of Squatty Potties, and, I just moved, and I was like, I have to take that with me. I was like, there's no way I'm going to forget my Squatty Potty in my move across the country. That's the only way.
It's kind of embarrassing, because I have one in our downstairs main bathroom, and people are like, you probably shouldn't put it there. But I'm like, the kids, I have, young kids, they actually use it to get on the bathroom. It's not, for us, but it's important. And there should be no shame in talking about pooping a Squatty Potty. So I want to destigmatize that.
Absolutely. And that's the thing. be frank. And again, whether you're South Asian, whether you're Caucasian, whatever your history or background may be, these are common symptoms that everyone is undergoing. So please don't feel like you're alone. You talk about food sensitivities, food allergies, constipation, bloating. This is things that is happening to everyone. So you're not alone. That's what's really important. And there is help for whatever you are undergoing. If it's a food allergy or food sensitivity, your allergist is going to give you recommendations. For me, for pelvic floor dysfunction, like Rena and Sonia talked about in the previous lecture, they talked about pelvic floor therapy. That's an 8 to 12 week course, once a week. You go and you do certain exercises to retrain those muscles to kind of learn how to relax properly and poop and then close up again instead of pushing against this wall where you're shimmying to allow poop to come out. And so I would definitely recommend it for all patients, especially after if you've had a crazy traumatic birth of a child, then pelvic floor therapy is absolutely fantastic. So there is help for all of these things.